Hello friends and dear parents. I am Dr. Beena Johnson, Developmental Pediatrician and Senior Consultant in Child Guidance. Developmental disorders are a group of conditions which occur in children due to impairment in physical, learning, social emotional, language or behavioral domains of development. I will be discussing about 3 common developmental disorders in this video. These common developmental disorders are Autism Spectrum Disorder, Attention Deficit Hyperactivity Disorder, and Intellectual Developmental Disorder. These conditions begin during the developmental period. If not intervened at the earliest, these disorders will cause negative impact in day-to-day functioning, and the problems usually last throughout a person's lifetime. Early interventions during infancy, toddler age, and preschool age are essential and are very effective in the management of developmental disorders. Autism spectrum disorder is a developmental disorder that causes significant social, communication, and behavioral challenges in children. Children with autism spectrum disorder have impairments in social, emotional, and communication skills. They also have recurrent, repetitive, stereotyped behaviors. The signs of autism spectrum disorder usually begin during early childhood, and if not intervened at the earliest, the signs typically last throughout the person's lifetime. The common signs of autism spectrum disorder are the following. The children will not point at objects to show interest. They do not look at the objects when another person points at them. These children do not have interest in interacting with other people, including the parents. They avoid eye contact and prefer to be alone. They have trouble understanding others' feeling. Individuals with severe autism spectrum disorder will not have meaningful communication throughout life. Children with mild autism may repeat the words or phrases said to them in place of normal language. They do not play pretend games like feeding a doll. They have lots of stereotyped repeated behaviors. These children may also have regression of acquired communication skills before 3 years of age. That is, they stop saying the words which they were using during toddler age. Early parent-mediated developmental and behavioral interventions from infancy to 3 years of age are very effective for behavior modification and also for improving the child's social, emotional, and language development. Attention Deficit Hyperactivity Disorder. Many children in toddler age can have trouble focusing attention on tasks given and may have some hyperactive behavior. But children with Attention Deficit Hyperactivity Disorder do not grow out of these behaviors. The symptoms can be severe enough to cause difficulty at school, at home, or with peer group. Depending on which type of symptoms are strongest in the child, there are 3 different types of Attention Deficit Hyperactivity Disorder: predominantly inattentive type, predominantly hyperactive impulsive type, and the combined type of ADHD. Predominantly inattentive type. It will be difficult for these children to organize or finish a task, to pay attention to details, or to follow instructions. These children are easily distracted and they usually forget their daily routines. Predominantly hyperactive impulsive type. These children fidget and talk a lot. It is hard for them to sit still for long. They run, jump, or climb constantly. They are restless and have impulsivity. The impulsive child may interrupt others a lot, and it is very difficult for the child to wait till their turn comes or listen to instructions. Combined type of Attention Deficit Hyperactivity Disorder. The symptoms of inattention, hyperactivity as well as impulsivity will be equally present in these children. For preschool age children, that is, children of 3 to 5 years of age with Attention Deficit Hyperactivity Disorder, behavior therapy, particularly parent training intervention, is recommended as the first line of treatment, and it is effective in improving attention and reducing hyperactive behavior in the preschool children. Remember to subscribe this channel, Press the bell icon to get all the updates from the channel Best Child Development and Parenting. Intellectual Developmental Disorder. These children usually have delay in all milestones of development. Children with intellectual developmental disorder will have deficits in problem solving, learning, reasoning, judgment, and other cognitive functions. They also show deficits in social skills, motor skills, communication skills, and eventually in independent living skills in future life. To have effective management of intellectual developmental disorder, developmental interventions should be started in early infancy at the onset of delay in milestones of development. Parents should be given scientific awareness regarding milestones of development of children. The early interventions to stimulate multiple domains of development involving parents are very effective in the management of intellectual developmental disorder. Neural plasticity is at its peak during early childhood. Neural plasticity permits the brain to reorganize the neural networks in response to stimulation during infancy, toddler age, and preschool age. Hence, developmental interventions will be very effective during this early period of development, and it should be provided to all children with delay in milestones of development. Parent training interventions are the key interventions in developmental disorders. Early behavioral and developmental interventions involving the parents will lead to victory over developmental disorders. Thank you all. Kindly subscribe this channel for future updates on best child development and parenting.